everybody for hearing us, letting us tell our story a little bit. I remember it wasn't that long ago when the vaccines rolled out, and there was just palpable joy throughout the organization that we were going to get by this. We had great success rolling it out. And we seem to hit a brick wall with a number of people in our communities that want to get vaccinated. With that, our numbers continued to go down. And much like Dr. Anderson reported, I think it was 6 weeks ago at UnityPoint, for the first time in over 400 days, we had 0 inpatients with COVID. Then we started seeing the outbreaks in Southern Illinois, Missouri. We started to learn more about how infectious the Delta variant is. And we started seeing a surge again. And I can confirm at this point, it's looking like a third surge. Just in the last week, I just want to share with you our numbers. We currently have 41 inpatients with COVID-19, which is the highest we've had since March. The percent of our positive tests in our clinics week over week has increased by 8%. We're up to almost 20% positivity rate, testing several hundred suspected COVID patients a day again. The number of inpatient positive COVID-19 patients has increased over the past week. Last week, we were averaging 19 per day. This week, 32. And again, right now, we're up to 41. And then the number of daily admissions has doubled in a week where we're admitting almost 4 a day again. So, the other thing I will say, and Dr. Durek will be talking about the medical profile and what we're seeing, is this comes at a time when we all talk about workforce recovery and healthcare coming out of a difficult year, and everybody's facing the same thing where we've lost a lot of nurses, we've lost a lot of respiratory therapists, and every healthcare system is facing that. So this surges in our region, and we're seeing a lot of other non-COVID illness, whether it's RSV or just patients that maybe have put out their care. We've got really sick people, and so the systems are strained. This is going to continue to climb. We've got to get people vaccinated, and we've got to continue to do the right things to make sure our communities are safe. The average age right now of our inpatients with COVID is 43. The average age of those that are testing positive in our clinics is 32. And so you can see the impact continues to be on everybody in the population. So with that, I will ask Dr. Durek, who's our chief of staff, president of our medical staff, to maybe give a little flavor of the medical profile, what we're seeing.